Hello, everyone. Welcome to Grey Matter, your one stop shop to all your exam preparation needs. As you know, we are going through the course of domains of PLAB, and in this series, today we are going to discuss the gastrointestinal, including the liver section. So, as you know, most of the cases in the GIT they come in the form of examination stations because there is an abdominal examination present and they have a mannequin there on which you have to perform the examination, the abdominal examination. So this section is usually important for the examination station. Like abdominal distension. Now, abdominal distension can be due to ascites, it can be due to some intestinal obstruction, or it can be due to some constipation. So, abdominal mass. Now, the mass can be due to some cancers, liver cancer, abdominal aortic aneurysm, or splenomegaly. Now, in the acute abdominal pain, the acute abdominal pain can be due to the important surgically, it can be due to appendix or appendicitis. It can be cholecystitis or pancreatitis. Ascites. Now this involves the liver, so it involves any pathology of liver. It can be cirrhosis. It can be any disease related to liver. So whenever there is ascites, it is you have to think about liver. And bleeding from the lower GI tract, it involves the peptic ulcer, the bleeding from the peptic ulcer, or the GIT perforation, or any cancer involving the intestinal tract or your rectum. And the bleeding from the upper GI tract, that is usually associated with some bleeding ulcer again, or some gastritis or esophageal cancer. Change in bowel habit, that can be some constipation, diarrhea, it can be any infectious cause, it can be any malignancy cause. With malignancy, fever, loss of appetite, and loss of weight would be present. Chronic abdominal pain is associated with two diseases. Now, this is usually IBD and IBS. So they are very important. Both of these are very important related to the UKMLA, inflammatory bowel disease. It is a chronic disease involving chronic abdominal pain and bleeding per rectum, which is relieves and then starts again. And IBS, it is inflammatory bowel syndrome. It is associated usually psychologically with stress, and it is also chronic disease in which a patient observes abdominal pain, which is relieved with defecation. Constipation, number of causes for constipation can be infection, and can be diet, decreased appetite, usually associated with cancer. So this is also associated with cancer. Diarrhea associated with a number of infections. Fecal incontinence. Now, fecal incontinence, it can be due to prolonged constipation, it can be due to prolonged diarrhea, or it can be due to some nerve damage. Food intolerance, you're not able to tolerate food, it can be due to esophageal cancer or some infection. Jaundice. Now, jaundice usually associated with any liver pathology or gallbladder or any ducts linking the two. Lump in groin, it can be some form of cancer, but mostly it is a form of a hernia or inguinal hernia. And melena, we have talked about it. Nausea, any number of infections can cause nausea or organomegaly. It can be liver, it can be spleen. Any number of infections can cause organomegaly. Perianal symptoms, they are usually associated with IBD, IBS, or any fissures or any hemorrhoids or cancer. Pruritus, it is the itchy sensation on the skin, and pruritus can be due to chronic liver disease, cholestasis. And rectal prolapse, it can be due to any prolonged constipation. Swallowing problems, again we have discussed it. Vomiting can be due to number of infectious causes. uh, so this is particularly a symptom that can occur due to variety of reasons. Weight gain, now that can be it is usually associated with as we have discussed in the previous videos, it can be due to some endocrinal crinal cause or some GI cause, simply because the patient is having sedentary lifestyle. It can be due to that. Now, the conditions which are important is acute cholangitis. It involves the triad of the pain, the pain in the abdomen, the right upper, the pain, and there's jaundice, and there's fever. Acute pancreatitis, this is usually pain involving the upper abdomen and which is radiating to the back. So and then we go towards the alcoholic hepatitis. The patient is chronic alcohol user and his liver functions are deranged. GGT is raised. Anemia, it can be due to pernicious anemia, previous history of gastrectomy, or iron deficiency anemia, any dietary cause causing iron deficiency, or vitamin B12 folate deficiency due to the dietary problems. Anal fissure, it will be a painful lesion on the anal region, and there will be fresh, bright red colored blood and pain on defecation, and you would not be able to examine the patient there due to the severity of the pain. And the appendicitis, we already know what that is. Ascites, we have discussed it. Cholecystitis is the infection, inflammation of the gallbladder. It can be due to stone, can be due to infection. Cirrhosis, it is a liver disease, and it is a chronic liver disease. Celiac disease, it is a disease that results due to intolerance of the gluten products. It results in diarrhea and pain. Colorectal tumors, there will be the fever, loss of appetite, and loss of weight would be present, along with perianal symptoms such as bleeding, or any mass, or constipation, diarrhea. Constipation, we have talked about it. Diverticular disease, diverticular disease would be same GI symptoms would be present, but there would be lower abdominal pain. Eating disorders, it involves bulimia nervosa and anorexia nervosa. Gallstones, biliary colic, it is right upper quadrant pain, and it is more pain due to on deep breath. And gastric cancer, against the flaws would be present, positive with along with the GI symptoms. Gastrointestinal perforation, so there will be fever, there will be blood through the stools, there will be nausea, vomiting, and pain. GERD, GERD, there would be a reflux of acidity on the, the acidity you feel when you have eaten some spicy food. So that reflux is called GERD. Hemochromatosis, it is the increase in iron levels in the blood. Hemorrhoids, it is the painless bright red bleeding through the rectum. Hepatitis, viral infection of the liver. It is also important. The hernias, we have discussed the inguinal hernias and the inguinal scrotal hernias. Hiatus hernia, it is the herniation of the upper part of the stomach that herniates through the diaphragm. Hyposplenism, as the name suggests, the spleen activity of the spleen is decreased, due to which there is pain on the left upper part of the stomach. Infectious colitis, there is an infection causing mostly caused by the E. coli or salmonella. Infectious mononucleosis, the disease that is caused by exchange of saliva. So there will be fever, sore throat, lymphadenopathy, and liver or spleen enlargement. IBD, IBS, we have discussed. Liver failure, we have discussed. Malabsorption, due to any pathology, the nutrients are not absorbed well. The fats, the proteins, the vitamins, they are not absorbed from the intestinal tract. Malnutrition, there is not enough nutrition present, due to which the health is degraded. Mesenteric adenitis, this is these two are for the pediatric section. Mesenteric adenitis, it is present in the children with fever, abdominal pain, change in the poo, and it is caused by the inflammation of the mesenteric lymph nodes. Whereas the necrotizing fasciitis, necrotizing enterocolitis, it is the bloody stools, the feed intolerance, and there will be bile colored vomits. As a fetal cancer, we have discussed pancreatic cancer, same as well. There will be palpable gallbladder, and there will be the same pancreatitis symptoms, along with fever, loss of appetite, and loss of weight. Peptic ulcer disease, we have discussed. Perineal abscess fistula, we have discussed. Peritonitis, there will be absolute constipation. There will be no bowel sounds will be heard, and there will be extreme pain, and it's an emergency. Vitamin B12 and folate deficiency, we have already discussed. So there you go, doctors. These are the topics that are present in the gastrointestinal section. It is a very relatively easy topics, and most of these topics occur in the examination station. So keep that in mind while you're preparing for the exam. Anyway, this is the video for today. Please like, share, and subscribe.